Infection control for aerosol-generating dental procedures during the COVID-19 pandemic. Please note that the PPE used will depend on the current phase of the pandemic. Precautions requiring a reused N95 respirator and a closed room are presented here. However, sequences for donning and doffing of PPE and the instructions for their reuse apply regardless of the nature of the procedure being performed or the PPE used. Proceed to the donning area. Use hand sanitizer, ensuring all surfaces of your hands are covered, and rub for 15 seconds. Apply your gown. Fastening at the neck and waist, ensuring that your scrubs are completely covered. Apply gloves and remove the N95 mask from its storage bag. Cup the mask with the nose piece up and both elastics hanging below your head. Fasten the upper elastic to the crown of your head, then apply the lower elastic to your neck, ensuring that it contacts bare skin only. Pinch the nose piece and perform a fit check by blowing with hands held above, to the sides, and below your mask. If air leakage is apparent, adjust the mask and repeat the fit check. Remove and discard your gloves and use hand sanitizer. Apply and adjust your loops. Apply your head covering. Apply your face shield and adjust your PPE until it is comfortable. Lastly, apply your gloves, ensuring that they cover the wrists of your gown. Enter the treatment room and close the door behind you. Remember to use these strategies to reduce the infectivity and production of aerosols during patient treatment. If your patient is wearing a reusable mask, it must be stored in a bag during their treatment. For your reference, there is a sign indicating the doffing sequence inside the treatment room. Remove your gloves and gown inside the operatory. Use hand sanitizer and exit the room, closing the door behind you. Proceed to the doffing area. A poster indicating the appropriate doffing sequence is available for reference. Remove your PPE in the sequence indicated using hand sanitizer between each step. Remove reusable PPE onto the countertop. Open the bag to be used to store your N95 mask. Remove the mask using the bottom strap, holding tension followed by removing the top strap. Examine the mask for damage or soiling and discard if damaged or soiled. Otherwise, it may be stored for another use. Use hand sanitizer and proceed to disinfect the reusable equipment. N95 masks can be reused a maximum of 5 times. The number of times the mask has been used so far should always be marked on the bag used for storage. The minimal downtime to observe before reusing a treatment room is determined using this chart and will depend on the phase of the pandemic. Your gown may be reused unless it is worn during a procedure that generates aerosol or it is visibly soiled or damaged. It is important to note that while donning a gown for reuse, it should be tied in the back to avoid contamination during removal. In this instance, gloves only should be removed in the operatory. Hand hygiene performed. Exit the operatory, close the door behind you. Use hand sanitizer again and proceed to remove your gown, being sure to touch only the back and inside of the gown during removal. Ensure that the sleeves are right side out for easier reapplication. Be sure to examine the gown for soiling or damage and discard if either is noted. Unsoiled, undamaged gowns may be stored on a hook with the front side facing the wall. If the face shield is visibly soiled, it should be disinfected and reapplied. To reapply the gown, access the sleeves and avoid touching the front. Retie the neck. Grasp both waist ties. On the right side, using your left hand, pull the front tie to the left, and using your right hand, pull the other tie to the right. Tie the gown in the back, ensuring your scrubs are covered. Use hand sanitizer. Apply gloves, ensuring that they cover the wrists of your gown. Enter the room and close the door.